Welcome back to Align by Faith and Innate. This episode is a special one. It's really going to be a mini education session. And I've been working with patients since I was 20. I now own my own health center. So I've had over 15 years of experience seeing individuals heal, from babies and infants to toddlers to kids to teens to adults to the elderly. I have watched thousands of people heal and help them walk through their journey. So I have seen so many different symptoms and adaptations and sicknesses heal just by removing interference to the body's healing power. So that's what we're going to be talking about today. We're going to talk about trusting the body's process of healing. And what I've found throughout the years that I've been in practice, 8 years now as a doctor, I have found so much fear when it comes to the healing process. And that is because so many of you have been lied to about the potential that you have to heal. We are raised up, most of us, in the medical model, fearing every single symptom and every single sickness. So at the root of this model is fear of what is happening in your body, and that we have to treat it, we have to remove it, we have to cut it, we have to poison it, we have to burn it. And this fear-based model has such a chokehold on the life of Americans and how we're raising families. And I find it at the root of every single process and journey that each patient has in their healing. And there's a lot of variation in that, depending on who's coming into my clinic. At the root of it, they're so afraid of what their body is doing because they've been trained by a doctor to fear it. So we're going to break that fear today, because everything the body does, every symptom, every adaptation, every diagnosis, every label that you would get in the medical model is the body doing the right thing to try and heal you and support you in the environment that you placed it in. So the body was created with this amazing intelligence within it. Think about this. When you go to sleep, your heart is still beating, your lungs are still breathing. You don't have to tell your body to breathe. It does it for you. It beats your heart for you. It took you from 2 cells to trillions. Your body has way more wisdom and way more intelligence than you do in your educated mind. And here's where we lose the plot. We lose the plot when we fear what the body's doing instead of trying to honor it and recognize that it's the right thing that the body is doing for what environment you have put it in and how you've stewarded or treated your body. Your body has way more wisdom, way more intelligence than the doctor down the street, than your chiropractor, than me. The body's innate ability to heal and have wisdom is incredible. And I just want to start with a really simple example. So I have a lot of families in my clinic. I have a lot of moms in my clinic, and what I see time and time again, and this is a really good marker for where you are at in your understanding of health, is how afraid you are when your child gets a fever or when you get a fever. If your body has a fever and you automatically think, I'm sick, I'm broken, I have to get rid of this fever, you're off base, because the fever is the body's mechanism of healing. It's the body's mechanism to save you. So to illustrate just one principle, this is how the body operates, and it's incredible. We're just going to use a fever. So the body's temperature normally is around 98.6. It constantly maintains that. Whether you're in the cold or in the heat or going for a run, your body is going to innately, intelligently shift back your temperature to keep you whole and well by sweating, by shivering, by all the mechanisms that the body does to keep that body temperature right around roughly 98.6 for most of humanity. Now, if there's something in the body that it needs to get rid of, or it needs to retrain or reorganize, because germs are very, very healthy for us. This is not about the body being afraid of germs or trying to get rid of something like per se. This is about the body readapting to it and using it for its own good. So let's say the body has a fever. So if we look at the fever, you're around 98.6. If the body goes up to 99 or 100, that is a higher temperature than normal. We would call that a fever. And at 99 or 100 degrees, what the body does is it's burning off excess inflammation. So when your body needs to heal an injury, it sets off the inflammation process. Inflammation is not bad and it's not a problem. It's the healing process. The problem is that you keep re-injuring the body, causing it to have lots of inflammation. That's really the problem. So what the body does to heal is never the problem. It's what you're doing to put the environment into motion. So the body sets off and creates inflammation. Let's say you rolled your ankle and it's inflamed now. It's swollen because the body needs to send more nutrients and it needs to carry away the sick or injured cells to replace them with new ones. So it swells, never take down swelling. It's the body's part of the body's healing process. So anything the body does, you don't want to remove. You want to assist it so it finishes its process, because the body's has a perfect way of healing as best as it can in a fallen world. So inflammation comes up, it heals the area. Now we want that inflammation to go away when the tissue is now repaired. So what the body will do is it will raise the temperature to burn off excess inflammation that it doesn't need anymore. So if you take the Tylenol or lower the fever, the body will constantly stay inflamed, and this is why you're always in chronic pain, or maybe one of the reasons. When the body brings the temperature up to over 100, 101, 102, we usually see more of an environmental change. So this is the type of fever that the body would be using to rebalance good bacteria. Like 99% of bacteria is really healthy for us as long as we have a strong, healthy immune system that adapts with it, because it will use that bacteria to create a stronger body suited better for the environment. The body uses viruses and bacteria to identify where it is and to readapt to that better environment to keep you alive and thriving. So bacteria are really great for us 99.9% of the time. It's just if your body is healthy enough to adapt to it. So it's always about the health status of your body, not the environment or the microscopic germ that you might come in contact with. So at about 100, 101, 102, maybe up to 103, the body is rebalancing bacterial balance to keep itself strong and healthy and prepare for the next season. At 104 or 105, that's when the body has an extra layer of its immune system that gets activated. So if your fever goes up to 104 or 105, that's the body fighting or healing through or adapting through a virus. And I wouldn't really say fighting. The body doesn't need to fight a virus. It adapts to it, it sees it, it learns from it, and then you're better off after going through a process of a viral infection. It's very healthy and normal for us to go through temporary changes and adaptations with bacteria and with viruses as we're walking into new, different environments, growing, and our immune system is learning. This is why we have immune milestones for kids, just like we have neurological milestones, crawling, rolling over, walking. The timing is very important for brain development. The timing of measles, croup, rubella, the common childhood self-limiting or self-healing infections that we go through are also immune system milestones. So if you go around those, your immune system never truly develops well. If you're always shutting off your body's healing, it's never going to be truly healthy and well. So what we do is, if I see a parent come in and their kid has a 103 fever or a 104 fever, or sometimes even a 105, they're terrified of that fever. That's the body doing the right thing. We should be excited. Yes, the body has a fever. If it didn't have a fever, I would be concerned that you don't have proper immune system function. And that's a worse problem than going through a fever. So if you are afraid when your body has a healing mechanism, that automatically tells me that you're anchored to fear and you need more education about your body, because the fever mechanism is brilliant. We never want to shut it off. Now, the fear comes in because you've been taught that maybe you or your child could have a febrile seizure. So if you look at the research, 99% of febrile seizures, there's no injury to the body whatsoever. It's just the body resetting to lower the temperature. So if we have a febrile seizure, and it's very uncommon, but if we do have a febrile seizure, There's statistically no injury to the body when that happens. It's just like a reset of the system, and then the body brings the temperature down. But if we're constantly lowering a fever or lowering the body's healing mechanism, you're ruining your body's ability to heal itself. That means you're going to be chronically sick longer because you never allow your body to go through the process it needs to, and it will constantly try to redo that if you don't let it. If you don't let the body learn the lesson and learn, just like life, you're going to go through it again and again and again until you learn the lesson and you develop the stronger healing. So if you're afraid when you or your child has a fever, that automatically, to me, it makes me understand that we haven't gotten you to the place where you should be about your body's intelligence and brilliance in its healing. We don't want to get rid of or repress a fever. We want to assist it so it can finish the process and your body heals and it comes out of that adaptation or out of that symptomatic process for you. And if you are seeing a really, really high fever that you have fear associated with it, typically I only see a febrile seizure when there's medical intervention. So you get afraid and you take a Tylenol, or you have your child take a Tylenol to lower the fever. And when the body burns through that dosage of medication and it's not there anymore to repress the fever shoots up very quickly. And that's when we typically see a febrile seizure. It's because you've interfered with the process, and now the body shoots it up really quickly as it burns off that medication, which shouldn't be there in the first place. And that's why it gets the seizure. It's not really because of the innate mechanism. It's because you went and you tried to thwart or change the innate mechanism of healing. And now you're going to get a febrile seizure. That's actually most that I've seen. And it's very, very uncommon. And there is very little documented negative consequences of a febrile seizure. So to go back, if you've been taught to always fear what your body is doing, you're always shutting it down, you're never going to be truly healthy and well because you're fighting what the brilliance in your body is trying to accomplish, which is good for you. If I am going through a symptom or adaptation, or like regular humanity calls it sick, cold, stuffy nose, I have a sore throat, I have body aches, that is my body doing the right thing. And I listen to it and I allow it to happen. Here's where we get messed up. Because you've used medication the majority of your life, every time you had a symptom, your body typically has longer than desired timeline to go through these sicknesses because you never allow your body to actually fully heal itself. You always kneecap it with medication and stop the process. So what happens is I see my patients and they're expressing a cold symptom or a virus for sometimes 2, sometimes 3 weeks. And they're like, what is my body doing? I must be extremely sick. And they try to keep shutting it down. Let your body walk through the process in the timeline that it needs to. It is normal sometimes for a virus to take about 14 or 21 days to completely process through the body. Now, it's not fun. It's not convenient. And I know in our society, we're addicted to convenience and being 100% all the time. Well, if you never allow your body to heal itself, you're really going to struggle because you're going to be constantly sick and constantly expressing symptoms. And every single year, you go through the same sicknesses every time, or you have recurrent strep every single year. Your body is always going to try to accomplish this. So if you keep shutting it down, it's going to take longer. It's going to take a lot longer, and it's going to be a lot more inconvenient for you. Just trust the body's healing process. I see patients that walk into my office and they're still able to go to work. They're like, I'm not 100%, but I'm still not feeling well. I still have a cough. I still have a stuffy nose, whatever it is. They're well enough to come into the office and they're like really frustrated with it. I'm like, you're fine. You're fine. Your body is doing exactly what it needs to. Get more rest, trim down your schedule, give your body what it needs and its nutrients, remove interference with the adjustment, and allow your body to walk through this process. It's doing it in perfect timing. And the less you try to rush your body's healing process, the more excellent and quick it will be. So you're okay. Like your kids are okay. They are running around with that 103 fever outside. They are okay. And it's very rare that this actually happens. It's more of, I would say, when we have to maybe use the medical model, It's very big trauma, broken bones, a really big cut, something needs stitches. It's those kinds of injuries that really do thrive, and the medical model truly does help us, but it's still the body that does the healing. The doctor is going to reset the broken arm, but then the doctor is going to put it in the cast and the body is going to heal it. It's not the medical model that heals things. The medical model might sew your cut up so it can heal itself, even, I would say, better than if you left that cut open, and susceptible to dirt and things that we don't want. The body, or the Bible always talks about being clean and cleanly, because that's a part of healing. We don't want dirt and like dust in our body's healing mechanism, but it's never the doctors that do the healing. The body still has to heal. It's just a little bit of assistance in the trauma realm when there's lots of like external injury that comes into the body, but not the body healing itself through bacteria, viruses, inflammation, and like small injuries, like sports injuries. Trust the body's healing. It's always doing the right thing. Now, here's another thing that I see with the healing process. You expect the adjustment to do the healing. The body does the healing. The adjustment removes the interference. So the adjustment is the best, and I would say the only mechanism that truly removes interference to healing. Anything else that you would do in the functional medicine model, whether it be herbs or vitamins, that's support that will help the body, but it doesn't remove any interference to the body's healing power. That is the purpose of the adjustment. It's to take man, the physical, and reunite it with man, the spiritual, and reunite it with its maximum healing in that moment. So when you get adjusted and interference is removed, your spine goes back into place, your body is healing better. Now, the longer you get adjusted, the more healing you'll see, because you're remaining in better alignment and you're pushing towards that 100% function aspect of your body. So if you're coming from a really big deficit, it takes many adjustments to get you back to 100% function and healing. But the purpose of the adjustment is to remove the interference so the body can heal itself. So what I see in practice is so many times we get an adjustment, right? I give an adjustment and I have a patient stand up off the table and they're like, it's gone. The pain is gone. The symptom is gone. Healing has immediately happened and everything is restored. That typically happens a lot with long-term patients, where they come in a small symptom and we clear their nervous system, not based on the symptom, but because it needs alignment. And they get up off the table and they're like, the headache's gone, the back issue is gone. Oh my gosh, my stomach is calmed down. Or they get adjusted, they're not feeling good, and they immediately throw up and they feel better. So the truth is, like, the interference removed sometimes produces immediate symptom change. Sometimes it doesn't. Sometimes you get adjusted and you don't feel a change yet, because the body still needs to heal more, and it needs a longer timeline, and it needs more adjustments to remove more interference for you to feel a difference. But the purpose isn't to feel the difference a second after you get adjusted. It's to remove the interference so the body can heal itself optimally without restriction, without interference. The greatest thing a doctor can do is remove interference to your body being able to heal itself, because that is true cure. The body has the cure. So in chiropractic, we talk about the one cause, one cure. And the one cause, one cure is not the adjustment. The one cause is the body's inability to heal itself. The one cure is the body's ability to heal itself, whether it's cancer or digestive issues or back pain or headaches or ADHD or behavior issues. Like, the body is doing that in response to the environment. And when we start to strengthen the body and get it to its optimum function to suit the environment, healing happens. And you start to function better, and by side effect, you start to feel better long term. Now, there's also times when you get adjusted and you feel worse before you feel better. Now, that is the right thing as well, because the adjustment isn't dictated by symptoms or sickness or diagnosis. The adjustment and where you are adjusted is dictated by where you're out of alignment and where there's interference. And the body uses symptoms to heal. So if you get adjusted, sometimes you experience more symptoms because there's more healing in your body before you start to feel better. And you need that symptom. Pain draws us closer to God. It's a learning moment, and it helps us understand where our limitations are in our healing process so the body can fully heal. So I want to give you a really clear example. This happened in practice, and this has happened to me in practice so many uncountable times. I have learned, because it's right and true, the body knows how to heal itself. It just needs no interference. That's right and true. The body was designed and created to heal. Now, I've seen evidence of that, but just because I've seen evidence doesn't mean that that is the only reason why I believe this. I believe this because it's aligned with a capital T truth. And then it's always true whether we feel it or not. But I've seen evidence and time again. Science proves the capital T truth, and also evidence in healing and watching people heal always proves the capital T truth. But it doesn't, just because there's evidence, that doesn't mean that it's true. It was true before the evidence. The evidence just supports it. So I was adjusting one of my patients, and her second vertebra in her neck, so you have 7 vertebrae in your neck. Each vertebra protects a part of the spinal cord, and then also 2 nerves that are exiting out and branching into the muscles, the cells, the tissues, and the organs and the systems of the body, because the nervous system runs everything. And chiropractors clear interference in the nervous system by way of the chiropractic adjustment. It is the only thing that clears interference in the nervous system is the chiropractic adjustment. Not nutrition, not exercise, not detox. Not that those things aren't good. They're great and part of healing, but it doesn't remove interference in the nervous system, the healing system of the body. That is the chiropractic adjustment. And it's not a manipulation. It is an adjustment, restoring to proper alignment. And only chiropractors are trained to properly do this. Some do it more corrective and better than others, depending on their training. We're after more corrective care, which is why we see this a lot. So I had a patient come in, and her second vertebra in her neck, her C2, was out of alignment. Now, she did not have any neck pain. She was not symptomatic in her muscles in her neck, or like in her neck. She didn't have any neck pain at all. But her second vertebra was out of alignment or subluxated. And my job as a chiropractor is to reduce subluxations to their most minimal form. So I realigned her C2, and it realigned to about halfway it needed to, and it immediately got flared up. Immediately started to hurt. She had a really, really tough neck pain after her adjustment. Now, it was only 50% of the way in place. So I did a different adjustment to clear the rest of it. And this took a little bit more time. Sometimes this happens, not all the time. Every adjustment is the right adjustment. Some adjustments are shorter, some adjustments are longer, some adjustments are noisy, some adjustments are not. The noise and the length of time does not dictate the healing. It's the realignment, however long or little it takes, however noisy or not noisy it takes. So I continue to realign her C2. I get it back in proper position, and she's still in a lot of neck pain. Now, symptoms do not dictate the effectiveness of the chiropractic adjustment in the moment. It's the alignment. So I finished her adjustment, knew that it was back in place. That's my job. Chiropractors go to school for 8 years to know how to detect and clear subluxation. We also pass every single class and board exam that medical doctors pass. Aside from a lot of pharmacology, we have less pharmacology, but we do have one class of pharmacology or pharmaceutical intervention in chiropractic school. We take a lot more nutrition, a lot more anatomy and physiology, and a lot more adjusting classes to know how to find, detect, correct subluxation. So I know it's back in place. That is my job. How does a surgeon know that the surgery is complete? That's their job. They're trained to do it. So not the patient's job to dictate when and where you're adjusted. It's the chiropractor's job. You don't know where you're subluxated. You might have an inkling because there's pain there, but that might not be where you're subluxated. And symptoms and a patient doesn't dictate route of care. A good chiropractor does. So as a clearing corrective chiropractor, cleared her C2, she was still in pain. That doesn't mean that it was a bad adjustment. That means it's the right thing in that moment. So her body was clear. It was healing now. Whatever the body needed, it needed that pain response because now it's back in alignment and more clear. So she left in some neck pain after her adjustment. And as the day goes on, we get a text from her about, I would say, maybe an hour and a half later. And she says, the lymph node that was in my neck that's been swollen for weeks, completely clear and gone. My right sinus was so blocked off when I walked into the office right here. C2 runs immune system, runs lymphatics, also runs your sinuses, is completely unblocked. It's been blocked for a couple weeks now, and the pain is almost gone. That was the right adjustment. And she might have, quote unquote, felt worse right after she had the adjustment, but look at the healing that it brought. Trust the body and trust the chiropractor is doing the correct adjustment. It's not of our knowledge to pick and choose what gets healed when. That's the body's job. Our job is to remove as much interference as possible. And countless times I have seen this where a patient is like, man, I got really flared up after my adjustment. And it sometimes happens. That is the body doing the right thing. It needs alignment. It needs clarity to go back and heal something. And sometimes it uses symptoms. And then as you get adjusted, yes, of course, symptoms heal. Symptoms get better. Sickness and disease process gets better because your body is in a better healing state. But the purpose of the adjustment is not to instantly make you feel better. It instantly helps your body heal. So yes, long term it heals and you start to feel better. But the body is always doing the right thing at the right time. The body's intelligence never injures or destroys the structure in which it works. Imagine if I didn't clear her C2, didn't adjust it because she was, oh, your neck doesn't hurt, then I won't adjust it. That's not why a chiropractor adjusts you. A chiropractor adjusts you to realign your spine so the innate intelligence and healing can display fully in your body so you can fully heal, fully be present, fully connected your physical body to your spirit as well. The adjustment unites those two so you can be in maximum unification of your body's healing and spirit and soul that it has. That's the purpose of the adjustment. This is why some people, they get adjusted, they feel a little bit worse, and then they get better, and then things heal that they haven't seen heal in years. Trust the process of healing, and the body is always doing the right thing. As you continue to get adjusted and live this high healing life, you will see so much fruit. But the basis of that fruit is faith in the intelligence and healing and wisdom of the body because it was created by God. Your genes, your cells, your tissues, your healing mechanisms were created by God. So why do you think you're smarter than that? We're not. We're not smarter than that. The body's healing mechanisms are excellent. They're the best. They trump every pharmaceutical. So once you understand that, if your cholesterol is high or your lab work is imbalanced, it's not in that normal range, that is the body trying to heal you through the environment that you've put it in. So once you start changing the environment, what you eat, what you think, how you process your body's healing in your mind, what you tell yourself as your body gets adjusted, gets more healing, more clarity. Yes, of course, we see lab markers get better. But when I see a lab marker imbalance, I'm not afraid. I look at it and I'm like, the body is doing the right thing. When the cholesterol is higher, cholesterol is the fire extinguisher in the body. It's the best thing when there's lots of inflammation and things are brittle and they're wearing out because they're inflamed, because you're constantly re-injuring yourself because you're doing the wrong mechanisms, bad posture, bad injuries, lots of falls, lots of micro trauma, lots of EMF exposure, lots of toxin exposure. Like, this is the world that we live in. So the body responds by inflaming an area to heal it because it's getting worn out by the environment, the bad, poor environment that you put your body in. So if the cholesterol goes up, the cholesterol is not the problem. The cholesterol is like the duct tape. It reinforces areas and vessels so it can start to heal, so those vessels don't explode because they get so brittle and inflamed. Now, we need to remove the cause of the inflammation, the high sugar, the repetitive trauma, the deficiencies that you have in vitamins and minerals, so your body can effectively be in a non-inflammatory state. If you're constantly doing things that cause inflammation to happen in your body, the cholesterol is not the problem. It's you and your actions. And we need to take responsibility for that. We are not victims. We have responsibility in our healing, and our healing is dictated by the actions that we take. But if the body is doing a healing mechanism, raising your cholesterol levels, It's not our job to go in and then drop the cholesterol or drop the fever with a drug. It's to assist the body in healing that area, remove interference to it, and support the body's healing by saying, okay, I'm going to stop doing the things that cause so much inflammation in my body. And then my cholesterol levels will start to fix because they're not the problem. They're the response of the body trying to save me from the inflammatory actions I'm doing to my body. And the cholesterol is trying to help me. The fever is trying to help me. So the goal here is that you remember and have faith in the wisdom that God created and the healing mechanisms that God created for your body. They are not injuring you. They are protecting you. They're helping you survive instead of die in the moment when we are in a constant barrage of things that injure our bodies, from sitting in front of a computer all day long to so much high stress with the news, carrying the world's problems we were never meant to carry. We take on a lot and we self-injure our body a lot by the bad practices and foods and medications and chemicals that we ingest that hurt our body. So the reality is your body is always doing the right thing at the right time, even sometimes after the adjustment when it doesn't feel the best, but it will start to heal because there's less interference there from the chiropractic adjustment. There was one time I had a patient and she had just terrible, terrible back pain. She came in because she had back pain, adjusting her. She starts getting adjusted and she starts having massive, massive bowel movements, massive diarrhea, constant diarrhea after adjustments. No change. So she's got back pain. She starts getting adjusted. We analyze her scans and her x-rays. So we are doing the proper adjustments for her. 90 days later, she's still in the same amount of back pain. And now she also has terrible diarrhea all the time. Now, these are the mechanisms the body uses to heal. And sometimes a lot of times the timeline for our healing is longer than we want because we live in an Amazon Prime society. We want things healed in 3 days and we've been hurting ourselves for years. It doesn't work like that. It takes time. So I'm encouraging her. We're doing new scans. We're doing new x-rays. We're seeing positive change and clearance of her interference, right? She's not going backwards in her x-ray. She's not going backwards on her scan. Her body's adapting exactly how it needs to. And we're 4 months in. And on month 5, she gets maybe her 39th adjustment. And she comes back in the next adjustment after 39 adjustments. And she says, oh my gosh, Dr. Christine, it's all gone. Ever since that 39th adjustment. It's all gone. No more back pain, no more diarrhea. Like that was the body doing the right thing, kicking out what it needs to, right? The bowels kick out toxicity. They process out things that you don't need, processes out waste. Her body was getting rid of all the stuff it didn't need that was injuring it. And it kicked on because the adjustment cleared interference and the body started to work better and function better. And it kept that pain and it kept that diarrhea until it didn't need it anymore, until things were fully healed. Trust the body's healing process. Now, as chiropractors, we are always making sure that we are doing the right adjustment. And it's not subjective or subjective or changes with symptoms. The adjustment changes objectively by your x-rays, by your scans, and also by the checks that we do every single time you're in the office when you get adjusted. Like chiropractors just don't adjust for the sake of adjusting. They're finding the interference and the misalignment, the subluxation, and they're clearing it. They know exactly where the subluxation is. They know exactly how to clear it, and the body tells us when we're done. The body literally, when our neurological checks are imbalanced, so we check you neurologically in every single area of your spine. That's why chiropractic school takes so long, because you get to know the body and you're learning these checks to see where you've gone out of alignment. Yes, we use x-rays. Yes, we use scans, but we also check neurologically every time you're here to pick up anything new that might not be in the x-ray, might not be in the scan yet as well. So we neurologically check you, wherever there's interference, and then we palpate to see where the misalignment has gone so we can restore it to normal motion and normal alignment as close as we can get in that moment. And then when the recheck is done, things are balanced, that subluxation or misalignment has been reduced or removed. Your body's always functioning better. Your body is always functioning better when you're in alignment. That's science that just proves what the Bible has said about the body being able to heal, and healing comes through the brain and the spinal cord, also in the Bible. So the goal is, like, it's not about the symptom or not the symptom, or the sickness or not the sickness. It's about constantly living in alignment so your body can adapt and heal like it was created to. And that brings a great life. And that also brings a life without fear. It brings a life without fear, because anything your body would create itself is what it's doing to heal you, not destroy you, not kill you, but to save you. We now know that cancer is a wound healing process, that every type of cancer is the body creating cells to heal a wound, whether it's too much sugar and your metabolism is all thrown off. It creates cells that feed off more sugar because you've got so much sugar in the body. Like, it's the body doing the right thing and healing a wound. And the wounds are lack of the 5 essentials. Wounds come into the body from not eating a proper nutrient dense diet for your body. If you put the wrong fuel in your car, it's going to get defective and sick. If you put the wrong fuel in your body, it's a wound, and the body will create an adaptation to help that wound. And that constant influx of bad food for your body, less nutrient dense food for your body. An injury can also be having deficiencies in vitamins and minerals. An injury can also be having too much toxicity, things that the body doesn't need, heavy metals, glyphosate, pesticides. Those are interferences that damage your body's cells, and your body responds by putting cancer there to help you. Cancer is a wound healing process. That's the research about cancer. So the body is always doing the right thing at the right time. Even with heart disease, the body is laying down cholesterol in those vessels because they're inflamed, because you've intaked too much sugar, too much toxicity, too many deficiencies for a lifetime. And those cells are crying out for help, and the body creates this disease process so it doesn't instantly die and that vessel explode. The body is always doing the right thing. Now we need to get in alignment with how to steward the body well, and then we see those adaptations, those disease processes heal. Seen heart disease heal, seen cancer heal, seen digestive issues heal, colitis, Crohn's disease, headaches, migraines, behavior issues, sensory issues in kids, ADHD. Like, these are all adaptations for the environment. So when you change the environment and then you make the body stronger from the inside out and give it what it needs, you see normalcy return, and normalcy is really good health that you were created to have. So the more that you see your body heal, the more that you should trust it. Now, I see it time and time again. So I can always tell you that the body is doing the right thing at the right time. It just needs no interference to do it. And you will see miraculous healing, and you will see a miraculously healthy life when there's no interference in the system and the body has what it needs to thrive. That's where your focus should be on. And then as you focus on that, doing the right things for your body, and put your focus on that, the right thoughts, the right habits, getting adjusted every single week, you will see those outcomes that you want to see. Better lab work, better feeling, but not in every moment. Trust the body's healing process. Sometimes it has to increase pain to fully heal. Trust that body's healing process. Just make sure you're doing all the right things that you know to do. We have a problem when we're not doing the right things that we know to do. We're not eating well. We're cheating on our nutrition plan too often. We're not above that 90 percentile of good, healthy, whole foods that are in alignment with with the healing power in our body, not putting more interference in. So the question always becomes, are you doing all the right things to have your body to heal? Not, it's taking too long. Are you doing the right things? Commit to the process of becoming well every day, and you will see wellness and you will see healing. Don't skip out on your adjustments. Don't get nervous when you see a symptom arise. Keep doing the things that you know to do, and you will see continuous healing. So glad to have you guys here. Can't wait till next week.